I have a spondy and stenosis and clicking and popping in my lower spine. I'm afraid to arch my lower back. Will CBD exercises fix that? It's familiar to me as someone with a history of both spondy and stenosis to be afraid to backward bend, especially in the lumbar spine. It will cause pain. It will make the spondy worse. Clicking and popping is associated with that. In my case, it was associated with that. And a lot of the times it was non-painful clicks and pops, like just shifting movements of my lumbar spine that I could feel at one specific level. In my case, it was L5-S1. Later, it became painful. And, that's when things got a lot worse. So it is something that we want to minimize, especially if it is coming from your lumbar spine vertebrae. It could be the sign of an instability, which is a spondylolisthesis is inherently an instability. So lumbar instabilities are a lot more common than we might actually think. We just label it spondylolisthesis, but in the most general sense of terms, it's an instability. People don't realize that they might have an instability in their spine. What we need to be doing is stabilizing it. How do we stabilize it? Well, we learn to engage the core muscles that surround it. That's the only tool we have. We learn to engage them in a way that helps increase the stability around our spine. And then we breathe into that engagement. It's even better because that intra-abdominal pressure acts like an anti-gravity treadmill. It decompresses the spine and stabilizes it simultaneously. It's like the best thing in the world. Here's a nice side view of the human body, the axial skeleton. And I've kind of divided it up into sections that are really helpful for anybody that is struggling with an instability or a spondylolisthesis or even stenosis in the lumbar spine. We want to stabilize this region, and the tool that we have for that is the core muscles, because we don't have a bony rib cage or a bony pelvis in this region, and that's why it's prone to instability. But we do have all those muscles. We all know that what muscles I'm talking about, but here's a visual of them. We've got layers of abdominal muscles that are designed exactly like a corset brace, which is highly effective at stabilizing the lumbar spine. And we have these biological, dynamic tissues that we can develop, build stronger, and help them to act like a corset brace that lives inside us. And that's not sit-ups that gets these muscles stronger. It's stability exercises. This is what core balance training attempts to do, is help you to develop stability in those muscles so that we can stabilize this region that doesn't have the bony support. And the other things that we try to do in the program was we help to mobilize the regions above and below this unstable region. Because if there's pure stiffness here and pure stiffness here, then this is the only region that can do the movement for you that you need to do to wash the dishes or put on your socks and shoes or do yard work or house chores or whatever it is you need to do. So we can't only stabilize here and then also be stiff here and here. We've got to get more mobility in our hips, especially in extension. A lot of people are restricted in hip extension as part of our lifestyle, as part of the sitting, the chair-laden lifestyle, where our hips are constantly locked in a flexed position for hours upon hours in our day. And the restriction of extension is because of all of the tissues and not necessarily just one tissue or a joint impingement or a problem with the joint. So the way we do that is just gradual exposure to extension type exercises like the bridge or like front anchors awareness and progression and the kneeling hip flexor push away stretch that we do in the program. We've got to get more mobility in our hips, especially in extension. And we've got to get more mobility in our thoracic spine. Both of these areas tend to get really stiff because of their anatomy, especially the thoracic spine. When we get more extension, more movement in general in the thoracic spine, it can help take the load off of the lumbar spine, literally, and also just in the sense that it won't have to move as much and we can be more effective with our stabilizer muscles. One thing you can do in standing that is also you can do laying down is you can just squeeze your glutes as hard as you can and that's going to lock in your pelvis and lower back. And that's just going to protect your lower back. And I still do this sometimes. I'm a little bit of a nerd and I used to do a lot of bird watching. You're looking up a lot. And so it has an effect on your neck and your lower back. And so I just started squeezing my glutes, locking in my pelvis, and then I just extend through my thoracic spine. Locked in is the best way to describe it. So that's another way you can kind of cheat and protect yourself and feel confident that your lumbar spine is protected during these movements. At the end of the day, you've got to get to the point that you're able to extend your spine. You have to. We can't go through life in only a flexed to neutral situation. Living life in a functional way, you're going to end up aging quicker than you should. And so there needs to be some gradual but progressive strategy towards the thing that you cannot do. And this is, I say it in a general sense, because this is so true for a lot of our restrictions. Every one of us could sit here and think, what is something that I avoid doing because I'm afraid of hurting myself? And the actual solution to that thing is not avoiding it. It's going towards it. But we can't go towards that thing, and in this case, extension. We can't go towards that thing aggressively and abruptly, and we can't completely avoid it. We have to do the dance of listening to your body and work towards being able to do the thing that we can't do or we don't feel confident doing. And that is the solution. That is the way that we can strengthen our bodies and the way that we can improve our lives. Because avoiding it is not going to improve your life if it's a functional movement. There are activities we can avoid, like I'm not going to become an off-roading enthusiast because of the vibration on my spine. That's just sitting in a car, pressing gas pedal, driving a car, right? That's not, I don't consider that a functional movement, but something like lumbar extension, at some point you got to be able to do that. And the journey towards that for you is going to be learning how to extend through your thoracic spine first. And so that is the front anchors push away, the upper front anchors push away, and the hips, hip extension too. So make sure to get down on the floor, connect to your core, and then get up off the floor and use that core connection in whatever you're doing in your daily life, because that's really the solution to this problem. The big picture solution is moving through life in a healthier way, not just doing a 15-minute daily routine. Eventually, you want to actually not have to do a 15-minute daily routine because you're moving through your normal life in such a healthy way. That is your core maintenance. That is your lumbar spine therapy. The way that you do chores around the house is healthy for your core. So with that in mind, everyone, I will see you again next week. Make sure to get down on that floor and connect to your core.